Good evening, everybody. Today is yet another amazing day because we're gonna be dealing with a very interesting topic. Now, this topic affects a lot of people, and it has led to a lot of confusion. Sometimes, at the point in time, people get frustrated because they don't really know how to handle this situation. Ladies and gentlemen, today we're going to be talking about diabetes mellitus. So, diabetes mellitus prevention and management. The unique thing about today's topic is that we're going to talk about a few extra things that we take for granted when it comes to management of type 2, management of diabetes. And as we go along, let's just stay tuned. In case I'm moving too fast, as usual, remember, you can just write down the questions you have because today is going to be full because I'm going to talk about certain factors and things that are related strongly with diabetes. I remember my humble self, Lucky. So today we'll be talking about blood sugar and insulin. We can't talk about diabetes without defining what it is. Then we'll talk about types, but guess what? There's a particular thing that causes diabetes that we often seem to neglect, and that's pancreatitis. So we're going to talk about pancreatitis, then we'll talk about signs and symptoms, causes and risk factors, and guess what? People are always asking, why is it that people have diabetes and then they end up having hypertension as well? What is the relationship between diabetes and hypertension? We'll be looking at that as well as other things. So ladies and gentlemen, without much ado, now, blood sugar and insulin. You see, the blood sugar level is the amount of glucose found in the blood. And a sustained elevation of blood sugar above normal range is what? Diabetes mellitus. Now, insulin basically is a hormone that is secreted by the pancreas, the beta cells, or the islets of Langerhans. And what it does is that it acts as a password, for instance. That means before sugar can move from the blood into the tissue or the flesh, insulin is going to allow that sugar to be recognized by the receptors on the cell. So when the insulin is not functioning well, or it is in short supply, or whatever the situation is, you find that sugar remains in the blood. And that's why some people term diabetes as starvation in plenty. What it means is that there's a lot of sugar in the blood, but the cells are being starved, and that's why people end up becoming weak, as well as having other symptoms that are particularly peculiar to diabetic situation. So anything that hinders the availability or function of insulin in the body cells, leading to an excess amount of glucose in the blood and high blood glucose that stays high for long, is basically called diabetes. Now, so simply by definition, diabetes is a sustained elevated blood sugar level above normal. Now, this elevation of blood sugar is what leads to a cascade of unwanted reactions in the body, and that's what we're going to be talking about soon. So controlling blood sugar level is key in the management of diabetes. As you can see, this drop of blood here is moving around with his glucometer to make sure that his blood sugar level is normal. Now, you see, we have type 1, which happens at a younger age. It doesn't mean that people that are adults cannot have type 1 diabetes, but it happens as a result of lack of insulin. The insulin is not available, and that's the reason why it's very dangerous, because one that has type 1 diabetes cannot do without insulin, because no insulin, no sugar going into the cells from the blood. Then we also have type 2 diabetes or adult onset, which is more common, because type 1 is basically in 5 to 10% of the. What it basically means is that the blood is resistant. The insulin is not being recognized by the cells or the tissue of the body. So the sugar remains in the blood. And that means that anything that can make this insulin to get recognized once again by the cells of the blood, of the body, it moves from the blood back into the cells, thereby depleting the amount of sugar in the blood and hence helping to resolve type 2 diabetes. Of course, we have pregnancy or gestational diabetes. This happens as a result of pregnancy and often resolves after birth, but predisposes women to risk of having type 2 diabetes later in life. But oftentimes, when these women put to bed, the diabetes situation gets reversed, and the patient, the pregnant woman who has just put to bed before. Now, this topic today, I especially squeezed it in because it seems as if it's a forgotten cause of diabetes often because people talk less about it. You see, this is simply the inflammation of the pancreas. Remember that the pancreas secretes insulin, which is necessary for recognition of glucose and hence movement of glucose from the blood into the cells of the body. Bear in mind that the major cause of this problem is alcoholism, excessive intake of alcohol. So inflammation of the pancreas can be caused by alcoholism and type 2 diabetes. Can you imagine that something that causes diabetes is also caused by diabetes? This is a vicious cycle or a loop that we hope never to find ourselves in. So now, infections like Salmonella typhi, Aspergillus, fungus, worms like Ascaris lumbricoides, hepatitis, and all that can also cause this. And guess what else? Drugs like anti-diabetic drugs, that is, drugs that are supposed to help to mitigate or curb diabetes, can also provoke pancreatitis. And pancreatitis itself can also cause diabetes. So you can see why oftentimes it is advantageous to use these nutraceuticals because they have no side effects. Because if we look at it closely, you see that these drugs that are taken for a long period of time, the question is, where are their metabolites going to? Where are the things that are produced as they function going to? They're just dumping themselves one area of the body, and they see the trigger of a problem or the other. You can imagine that metformin, that is very popular, that people chew like chin-chin, also causes a lot of problem in a long run. But sometimes when you weigh the risk to benefits, you find out that one may not have a choice than to take these things to move them away from danger. Now, you can see that statins, which are often used to reduce blood cholesterol, angiotensin-converting enzyme inhibitors like lisinopril, oral contraceptives and hormonal replacement therapy, diuretics like furosemide, antiretrovirals that take care of viral issues, valproic acid, and so on and so forth, can also provoke pancreatitis. Now, it is believed that it's caused by long-term deposition of toxic metabolites or substances by these drugs. Trauma can cause it. Gallstones can block where the pancreas is secreting its pancreatic juice and cause a lot of mayhem, as well as produce procedures like endoscopic retrograde cholangiopancreatography that is normally supposed to be used to help the situation, can also provoke this issue. Now, what are the signs and symptoms? You see, understanding diabetes from basic principles is very important with regards to management. The question is, why is it that people that have diabetes urinate often, drink a lot of water, and are often hungry? And this is going to give us a clear, simple explanation of this problem. You see, when there's excess sugar in the blood, the body tries to save itself by excreting this sugar through the urine. And that's why some people will call diabetes ito sugar, because when there's sugar in the urine, because the body is trying to expel this sugar out of the system. And one way it can expel the sugar out of the system is by what? Passing it through urine. And that's why you see ants gathering around urine of people that have diabetes. But unfortunately, as the body is trying to remove this sugar through the urine, what happens is that you begin to feel thirsty because water goes with it. And that's why I see diabetic patients often drinking a lot of water. Sometimes when they don't drink water, their tongue becomes dry, their eyes become dry, and a lot of other issues begin to ensue. But remember that because the insulin is not functioning properly, or the body is not recognizing it, that means the cells are still not eating glucose because they need glucose to produce energy. And hence the cells begin to cry to the brain that what? They are hungry. And that is why the patient begins to eat a lot. And eating a lot further increases the level of sugar in the blood, further increases the amount of urine being expelled to reduce the sugar, and further increases the need to drink water, and further eating more on and on like that. And that cycle continues until diabetes kills the patient, if the patient does not break out of that cycle. And that's simply the long and short of story from basic principles why people experience what they experience in terms of diabetes. But there are other things that people experience, and we're going to talk about those ones as well shortly. Now, we've talked about frequent urination. We've talked about increased thirst. As you can see, that guy guzzling water like somebody that has never taken water in his life before. You can see increased hunger, confusion, and forgetfulness. Observe closely that people that have diabetes oftentimes get confused. They can start a sentence, and in the middle of the sentence, they get lost. Of course, we have headaches, itchy skin, weight loss, blurry vision, which I'm going to explain shortly, weakness, because we know that glucose is not entering into the flesh. So where would the muscles get energy from when they don't have enough glucose? You understand? Mood changes. If you notice people that are diabetic, sometimes they snap and become very, very arrogant, aggressive, and they want to fight. They feel the whole world is against them. It is the sugar that is causing all these problems. Then next thing, they enter another phase of depression. My brothers and sisters in the Lord, depression is real in terms of diabetes, especially those that are unfortunate to have had their foot amputated. When diabetic foot, diabetic foot often leads to amputation. And these people are not happy when they see every other person around them running around on 2 feet and they are hopping on one. So you see, it leads to depression and suicidal tendencies. Paresthesia means that tingling sensation, burning and all that you feel at the feet, at the fingers, numbness and all those stories. That's just what it means. I will explain what that means later. And of course, poor wound healing, which is the onset and origin of diabetic foot. So the causes and risk factors include generally anything that leads to the shortage and or absence or loss of function of insulin results in diabetes. So high blood sugar causes diabetes, and diabetes causes high blood sugar. You can see this cat, it's just there drinking alcohol, but a lot of things around this cat tell us a lot about people that are usually diabetic. Of course, this cat looks stressed up, he's taking a lot of alcohol, and it is obese, amongst other things. It is lying down in a position that seems to have been there for so long, that means it's not even doing any exercise. And these things predispose people to diabetes. But let's not forget that generally, one can be genetically predisposed to having that, meaning that if both parents have diabetes, there's a very high chance that such a person is going to have diabetes. If somebody has, the father has, and the mother doesn't have, well, let's say there's a 50-50 chance that the child will have diabetes. Because remember that half of the genetic makeup of a human being is from the mom, the mother, while the other half is from the father. Now, in the case of type 2 diabetes, it's as a result of lack of insulin production, as aforementioned, and the risk factors include, in the case of type 1 diabetes, there's a lack of insulin production, complete lack of insulin production oftentimes, and the risk factors include trauma and damage to the pancreas. You can imagine someone that was punched so hard on the pancreas, and the pancreas becomes injured. So where would the insulin come from? Autoimmune attack. This is a part that is also forgotten in terms of diabetes management, because diabetes also has an autoimmune part. That means the body is also fighting itself, and hence leading to diabetes. Sometimes the pancreas has to be removed, and such removal can lead to shortage of insulin. And of course, viruses and some other things can also attack the pancreas, as well as what we call gluten found in protein, genetic predisposition, and pancreatitis that we spoke about earlier. Now, type 2 diabetes is very interesting. You see, there is insulin, but the insulin is not functioning properly. It's not even recognized. And this lack of recognition of this insulin is actually the major problem with regards to what type 2 diabetes. Once the cells of the body can recognize insulin, the patient that has type 2 diabetes begins to have what we call a reversal of the type 2 diabetes. So truly, believe it or not, type 2 diabetes is highly reversible. But trust me, it is not easy, as I'm going to explain soon. Now, poor dieting can also lead to that, because excess sugary beverages and foods, obesity. Remember that more than 60%, about 60% of people that have type 2 diabetes are obese. They are fat. And this obesity can be explained from the fat cells that are located in the body, because the fat cells of the body directly produce what we call adipocytokines. And these adipocytokines lead to direct provocation of type 2 diabetes. Of course, being overweight, smoking, alcoholism, pregnancy, as aforementioned, lack of exercise or sedentary lifestyle, aging, and something that will shock a lot of us, lack of vitamin D. You find out that this lack of vitamin D that people take for granted can actually predispose people to diabetes. And another thing you should understand again is that stress can also produce diabetes. Before we go on, I want to tell you, everybody here, that the two things, I want to remind us that two things that finish human beings the most on earth are cholesterol, excess cholesterol, and stress. Once you can handle excess cholesterol and stress, you are bound to live longer on this earth. Remember that fat is virtually a cousin of cholesterol, because fat can begin to accumulate as a result of excess cholesterol in the blood. So you can see that stress has come here, being overweight, obesity has gone there. We'll explain further why this is so. So now, diabetes is a disease of diseases. It leads to the manifestation of other diseases of free radicals. These free radicals are also known as reactive oxidative species. And you can see that these free radicals cause more damage because they attack DNA directly. That is why people that are diabetic often appear older than their age. Some of them, overnight, their hair just turns gray, bam, just like that. Because the stress of the free radicals bombarding that DNA has led towards aging. Aging is basically production of faulty proteins and tissues of the body. That is basically what it is, as a result of DNA damage. And that's why the fountain of youth, God hid a good part of the fountain of youth deep within our DNA. The moment we are able to crack that part of the DNA that conceals the fountain of youth, people will begin to live longer. Excuse me. So we also have insulin-independent tissues. What this means is that these insulin-independent tissues, they don't care whether there's insulin or not. Once there's a lot of sugar in the blood, they begin to swallow this sugar. And guess what? They are found where? In the eyes. That's the retina of the eyes. That's why people that have diabetes have blurry vision. Found in the kidneys, in the nephrons. That's why people that have diabetes can have kidney issues and their legs begin to swell up. And they are found in the nerve cells. And that's what we call diabetic neuropathy. That means the patient will begin to have peppery and tingling sensation at the extremities, like at the feet and others. Sometimes they will kick a stone, they will not notice because the nerve that connects to the foot has been damaged. So that's more specifically diabetic retinopathy, as aforementioned. We've also explained diabetic neuropathy, that's damage to the nerve, leading to those tingling sensation and all that. Diabetic nephropathy, which is damage to the kidney. Then we have high blood cholesterol. Believe it or not, your body is never idle. When you have excess sugar in the body, trust me, it will begin to produce things that you do not believe. And that is how it produces the things that lead to damage to the eyes and the nephrons. Also leads to excess food, come out with liver issues like fatty liver disease and a lot of other things like that. You can see that this part that has to do with cholesterol will give us the link between hypertension and diabetes shortly. So just stay tuned as we continue. In case I'm too fast, please write down your questions, and at the end of it, we'll attend to everything that we are asking. Now, cardiovascular diseases, because damaged blood vessels make cholesterol stick, and this will now lead to blockage. This blockage can be in the heart and cause heart attack or myocardial infarction, or can lead to a stroke or a cerebrovascular accident. Imagine diabetes can cause cataract. Who knew that? That shows you how deadly this disease is. And impotence, some people may not tell you, but trust me, once people have high blood sugar for a long time, they lose sexual function. They lose their ability to engage in entanglement. And that is as a result of the diabetes causing the blood vessels that supply the facility of entanglement from actually being stable enough to hold the blood there and sustain the entanglement prowess or capacity. And that is why you find that the patient begins to have sexual dysfunction or erectile dysfunction. In women, funnily, diabetes actually blocks the blood vessels that lead to the secretion of hormones that are necessary to make women receptible to entanglement. And that is why women that have type 2 diabetes or the other types of diabetes end up becoming sexually dead. That's how terrible diabetes is. Of course, it causes brain damage via hypertension and stroke, diabetic foot, as aforementioned, forgetfulness, delivery. Diabetes can make a baby so big, iPhone. The baby will be so large, so that they have to do cesarean section because the mother had high blood sugar and the baby had excess glucose to grow, and diabetes can lead to that. Then you can see that DNA damage is not left out, wrinkling of skin and aging, as I aforementioned, infertility as well. Arthritis can be caused by diabetes, my brothers and sisters in the Lord. There's nothing this disease cannot cause. And as well, the list goes on. And finally, the greatest disease of all, which is death. Now, let us see the relationship between hypertension and diabetes. I often tell people that diabetes and hypertension are cousins. You see, diabetes and hypertension often go hand in hand. The atherosclerotic or cholesterol blockade caused by diabetes leads to an increase in the resistance to blood flow. Because of the deposits of cholesterol all over the blood vessels, the heart will now need to increase its pressure to overcome these deposits as a result of cholesterol, secondary to high blood sugar as a result of diabetes. And by little, like some people will say now, from clap, now that's the start. As the thing begins to clog the blood vessels and the heart begins to increase the pressure, you find that the person becomes hypertensive. And that is how diabetes and hypertension are cousins. They move together. So it's just a matter of time. When someone begins to have high blood sugar, you begin to notice that the person will begin to have a high level of blood pressure. So this is just a pictorial depiction of just a few of the terrible things that diabetes does. Trust me, we cannot, this list is inexhaustible. We can't finish it. Diabetes, they are still discovering new things that diabetes causes in the body. You can imagine that some people are even postulating that when someone is diabetic and gives birth to a child, the sperm of that person is carrying, the risk of diabetes to the unborn child. Can you imagine? This disease is terrible. I don't wish this for my enemy. Now, this is how diabetic food goes. It's how it progresses. You know, it starts from, I'm feeling funny sensation in my foot. And before you know what's happening, there's a tiny red stuff. It opens up and expands. Before you know, the person can actually visualize the bones in the foot, and the foot changes color and may have to be amputated. So how do we diagnose diabetes. We just have to measure. How do we diagnose? Just have to measure the amount of sugar in the blood. But there are many ways we can do that, because sometimes when you go, fasting blood sugar simply means we're trying to know how much sugar is in the blood overnight. How does your body handle sugar overnight? And you can see that the normal range is about 80 to 100 milligrams per DL. But some people are saying that it is now 80 to 125. But brothers and sisters in the Lord, it is 80 to 100. Forget what people that are selling soft drink are telling you, because if they tell you that it is 80 to 100 and your blood sugar is 111, you will not want to buy Coke again or Sprite or Fanta, because that's just the truth. They will do everything. They may even tell you that it is 160 is okay, because they know that once you know your sugar is high, you stop drinking soft drink. So all forms of indirect ways to improve sales is what is making people believe that it is 80 to 125. Stick to 80 to 100. That is the normal range. Anything from 100 to 125 is pre-diabetes, and it is highly reversible. At this stage, in fact, if you just diet, exercise, use appropriate nutraceuticals like supplements, you find that the thing will reverse and it will even go permanently. Do not wait for it to go above 125 milligrams per DL, because that's when the person is confirmed diabetic. Now, there's something called 2 hours postprandial. What the health practitioner is trying to understand is how well does your body handle your sugar or glucose just within the space of 2 hours. They eat rice now, and that period that the blood sugar was up to 500 is enough to cause damage. So we catch some certain diabetes. Now, about 6 million Nigerians have diabetes. Guess what? 18 million are unaware. And that is why some people end up finding out when they go to check other things. Some people are just passing by and their friend is checking their, say, I better just check my own. And that is how the person discovered that he's diabetes. I have a patient that found out he was diabetes like that. He went somewhere and they were checking blood sugar. And his friend said, check. He said, nobody has sugar in my generation. And no, it is, by the time they checked it, his blood sugar was topping the chart. And trust me, you know, it was not easy for him. Trust me, because the way he had to reduce weight, and my brother, I will explain a few things to us shortly. So you can see that the risk factors for diabetes in Nigeria include genetics. But funnily, people in South, I don't know what you do diabetes. So I don't know what you did to diabetes, but diabetes seems to be more in the South part of Nigeria. Now, challenges in management of diabetes include late detection. A lot of people do not even have access to a glucometer. Some people don't even know what a glucometer is. Then we have self-medication, Sabinus. Anytime they're having symptoms, they go to the nearest woman, Madam, I beg, mix agbo for me for somebody where they urinate too much. And mix the one too for someone that is eating too much. Also, mix the one for someone that drinks water too much. I mean, what are you mixing? And that is self-medication. It's not nice. Denial is the one of nobody in my family has diabetes. I reject it. I this, I that. But the sugar is telling you, my brother in Lord, that you may need to collect an Oscar award for the amount of sugar that is in the blood. So you don't have any reason why you should deny what is happening right in front of you. Rather, find a God-given solution. Lack of competent health practitioners. Well, I don't know, but people are saying that a lot of us are leaving the country, aka Japa. But, well, remember that those that are leaving the country, many of them have to write exams and they have to pass so that they can have a scholarship abroad. Now, those that have written the exam and cannot pass, I wonder how competent they will be. Probably we leave that to God. So, poor health information system. Less than 10% of people living with diabetes are adequately educated on the disease. Imagine somebody living with diabetes and they told the person, do not eat carbohydrates. He said, no, I don't take carbohydrates. All I just eat is basmati rice. No, I don't eat carbohydrate. I eat toast bread. I toast the bread. That's lack of information. They are toasting bread, forgetting that the bread you've toasted is still bread. So these are things that people, you believe it or not, people ask a lot of questions that, in fact, sometimes when I have patients, they stay with me for up to 1 hour asking me questions on that they don't know nothing about diabetes. And when you answer these questions and they begin to follow the rules, you see their sugar will just go down like a plane that is descending into the airport or the tarmac. Now, see, lack of adequate health diagnostic infrastructure, poor medical compliance. Often diabetics are on many medications, and being a disease of disease, sometimes when a diabetic patient opens his bag of drugs, it's like a mini pharmacy. They become tired. At the time, they say something must kill a man. But trust me, if you stick to the plan as given to you by your healthcare provider, you may be most likely be lucky that if this type 2 diabetes and not type 1, it will most likely be reversed. Poor dietary compliance, you ask them, are you dieting? Yes, I'm dieting. I did not eat much. I only ate in the afternoon, four fufu and 1 full plate of this thing. They will be wondering, but I told you not. No. I only ate fufu. I didn't eat carbohydrates. You can see the person is already. Some of them, when you tell them their diet plan for diabetes, they say, so are you telling me I'll not eat rice? Some start crying immediately. Some start shedding tears because they cannot eat rice. I said, I didn't say you should not, just eat little. So it means others will be eating full plate, I'll be eating small plates. And that is also a problem in management of diabetes. Economic issues, cost of medication. Believe it or not, tiny drops of water form the mighty ocean. When you buy diabetic medication for 1 year, go back and calculate how much it is. You may have swallowed one Benz in your mouth if you're not careful. Now, depression, as I have mentioned, is good thing that is real reactions, the dieting, and some that eventually have is actually terrible. You understand? And leads to depression. And at the end of the day, some of them take their lives. So basic prevention and management of diabetes entails you have to, diet, stop smoking, of course, avoid alcoholism, exercise, because exercise increases the sensitivity of your body to insulin. Exercise, what exercise does to insulin is that if the gate narrow and begin to usher in the glucose from the blood. Weight management, we know that about 60% or more of people that have type 2 diabetes are overweight. So that is self-explanatory. And the highest of all is discipline. It is not easy that once it is 6 p.m., you have to stop eating anything. The only thing that passes your mouth is cucumber, cabbage. You start eating like a goat. I asked a friend of mine once, because I told a friend of mine, look, he asked, I said, look, if you know what goats likes to eat, except yam, eat it after 6 p.m. And he started laughing. Yes, you have to eat like a goat. And when I asked him a question, I said, have you ever heard of a goat that has diabetes before? He laughed and almost fell down. It is true. They're always eating vegetables. They're always eating grass and all these things. So the best in your best interest, eat what goats and rabbits like to eat after 6 p.m. The use of orthodox medication helps to take us out of danger zone. I don't want to start telling us about the side effects of these orthodox medication, but sometimes it is what will help the patient to, escape from death, from the jaws of death. But when you use these things for a long period of time, that is where you hear that the solution now begins to become a problem. Now, another problem is that sometimes when people use them, their body begins to become insensitive to them. So somebody that was taking 500 milligrams of metformin may find himself taking 1,000 mg. From 1,000 mg, they graduate to 1,500 mg per day in divided doses. Then they move to 2,000 mg. They say, okay, stop there. That's the maximum for a human being for now. Take linagliptin. At the time, the linagliptin is not working as well as it did now begin. It's a horrible situation. It just takes time before you know it. The patient begins to become depressed and tired. But the use of supplements for effective prevention and management of diabetes has virtually no side effects. These are what I call nutraceuticals. A lot of the things you find on your shelves in the pharmacy, once ago, that people used to just put inside pot, boil, skim, and one big company will just go there and put it inside tablets. It has herbs that are standardized. The reason why this is because we don't know what is inside. A woman that is not happy can just carry a little soap and put there, or just 1 spoon of hypo and make it taste different. Boil it and mix it. It's super. My brothers and sisters in the Lord, I wonder what your kidneys will be telling you. That's why it's essential to use sources have standardized and studied these important ingredients in this material. So if you ask a scientist that is sound or a health practitioner that is sound, what is in this product that makes it work? He or she will tell you that such and such an experiment was conducted by such and such people. They found out that chromium picolinate is inside these super greens, and that is what improves insulin function. Full stop. Go and ask the woman saying agbo what is inside her agbo, and you will see, now so with the dwarf, that's what you hear. So imagine what people are drinking and causing problem because they are looking for cheap solution. But sometimes cheap can be very expensive. Now, the importance of supplements in prevention and management of diabetes. These supplements are actually what I call nutraceuticals, and they help to reverse diabetes, especially pre-diabetes, improve the secretion of insulin by the beta cells of the pancreas. I will tell you something that you never heard, most likely never heard before. They help prevent diabetes in susceptible situations, attack free radicals that attack DNA that may lead to the production of faulty insulin. So you can see that free radicals can also lead to production of faulty insulin. They reduce excess glucose in the blood, reverse and prevent damage, caused by diabetes on the organs, like those of the eyes, the nerves, the kidney, the heart, etc., etc. Cachexia is unexplained muscle loss. That's why when people have had diabetes is terrible. By the time you finish with somebody that used to be fat will just begin to become slim. You may be asking the person, what is the secret to the weight loss? You think the person will tell you that it's diabetes. But it's diabetes that is helping the person. That's what I call fake weight loss. Diabetes is terrible. Then they help to resolve erectile dysfunction caused by diabetes, resolve infertility caused by diabetes. Brothers and sisters in the Lord, give me 1 minute to explain this part. This infertility is as a result of, you see, this sperm that carries your DNA material to go and meet your wife's egg. Okay, so you can see that this sperm is actually very important. You understand? In reproduction. And that's why you see some people go for semen analysis. They tell the person you have the 25 and the person is jumping, pass mark. But guess what? Out of that 25 million sperm cells, they tell the person only 20 or 10%. So you can see that person is automatically in trouble. Also help with weight management disorders associated with diabetes and let's just move straight into the crux of the matter. Now, examples of the things that can help with regards to type 2 diabetes include fields of greens. This contains chromium picolinate, which is very essential for optimum secretion and metabolic process of insulin, as aforementioned. Super greens is just the elder cousin of this, virtually is self-explanatory. Aloe gel is nature's elixir of life, a powerful adaptogen. What it means is that it reverts the situation back to normal. That's what an adaptogen does. And you see that it helps to prevent and reverse organ and tissue damage as a result of diabetes. Active Pro B contains good bacteria. Bear in mind that the gut or the intestine of the body has people that are having type 2 diabetes take probiotics, and they contain not any probiotic, but very powerful good bacteria like Bifidobacterium and Lactobacillus, Greek yogurt, and other probiotics. Now, calcium and vitamin D, which is 1,2,5-dihydrocholecalciferol, are very essential in the control of high blood sugar. They help optimal glucose-induced secretion. That means as you are eating your food, these help to tell your pancreas, oh, you are beginning to secrete insulin. And that's where a lot of people do not even know. And it also helps with that. Nature Mint contains chromium, as aforementioned. Immune Blend deals with the immunologic parts. Remember that I mentioned during pancreatitis that the immune system can attack the factory that produces insulin. Ag+ contains L-arginine and amino acids, but these contain amino acids that are the building blocks of proteins and muscle fibers in the body, and helps to reverse that. It also helps to improve blood flow to the heart because it is of nitric oxide, which is blood vessel dilator. It also helps to fight erectile dysfunction, just as it also allows blood to flow normally facility. Now, eye caused by diabetes, B12 plus. Bear in mind that the retina of the eye is just like a modified collection of nerve fibers. So as you're taking B12 plus, you find out that when you take it with eye vision, there is rapid rejuvenation of the nerves of the eyes. And also the paresthesia and all those issues that cause tingling sensation and all that at the tips of the fingers, at the foot and all that. Nation and regeneration of amenities and function will help with the heart challenges that are involved, usually with the hypertension that's often triggered as a result of diabetes. Garlic thyme contains lecithin and does to fat what Omo does to engine oil. So just imagine, it will just be washing the fat away from the blood vessels. And also, the blood vessels that supply the pancreas that produce insulin will have better blood flow and better insulin will be produced. Bee propolis is unique in the sense that it is a very natural, powerful antibiotic agent. So in case the pancreas has been infected and that infection has led to the production, to the particular problem that is leading to pancreatitis, this bee propolis will take care of that. Aloe blossom tea is a powerful anxiolytic because it contains chamomile. And it contains a lot of other things, but remember, some people that have diabetes are highly irritable and they find themselves waking up between 1 a.m. and 3 a.m. They cannot sleep again. Insomnia. But this will also help, and it contains other substances that can help. Royal jelly is the fountain of youth. It helps, of course, reverse erectile dysfunction that is associated with type 2 diabetes, and being the fountain of youth. From its nickname, you can tell that have taken place in the brain because of the choline content and other places. Just generally, multi-marker helps with sexual dysfunction, vitalize men and sexual function and performance. Vitalize men also helps what is called sexual dysfunction that is strongly linked to type 2 diabetes. Then weight management is very essential. We have the Garcinia Plus that contains hydroxycitric acid that helps, that hinders conversion of carbohydrate to fat. 10 bonds fat directly into energy. Chromium trichloride helps in the metabolism of carbohydrates, and C9 generally helps us to reduce weight in a professional manner. Yes. So it's important we know about these products and how they function, because that will give us a better idea of how to use these things to manage issues like type 2, to help in the management of issues like type 2 diabetes, and so on and so forth. So bearing in mind that understanding the forever living language, or in other words, product knowledge, will help us understand how to use these products to help in management of various conditions and achievement of various health goals. You are what you consume, and there is a constant battle between factors that repair and protect our bodies and those that break it down. Be on the winning side. Thank you very much.